Hello, good evening, and welcome to this evening's conversation. Like we announced, I am joined by Dr. Delau, and him and I are going to discuss the issue of substance use disorder. And particularly, we are going to focus on alcohol as a concern or as a psychiatric or mental health concern. And I have with me Dr. Delau. Dr. Delau is a psychiatrist with extensive experience in dealing with matters related to alcohol use or abuse, as the case may be. But here we are discussing issues of alcohol use disorder. And pay attention as we go through these matters and tag somebody, invite somebody, because this is a very important topic. And at the end of this conversation, please do share this video as widely as you can in your circles, because we need to get this message out. Now, you will notice that generally speaking, alcohol use disorder is associated with a number of physical, mental, spiritual, and including social problems. It's associated with violence in homes, neglect, self-neglect, neglect in families. Now, let me not go into detail because this is not my show. Ideally, we've brought Dr. Delau here to walk us through these issues. Now, do go ahead and tell us where you're watching us from. And also, while you're at it, do tell us if the sound is good. But in the meantime, I will allow Dr. Delau to go ahead and introduce himself. I know that we probably have people who are seeing him for the first time. And so for the benefit of those who are seeing Dr. Delau for the first time, please, Doctor, do introduce yourself once more.
All right. Hello, everyone. And once again, thank you, Dr. Mujajati, for this opportunity. My name is Dr. Naeem Dalal. I am a psychiatrist, which basically means I help people with mental health conditions and disorders, based here in Lusaka, Zambia, at the university teaching hospitals, and also have extensive experience with grassroots outreaches. And I've been doing this for some time, and I'm very excited to be here in our series of substance use disorders. And today we'll be looking at alcohol.
Right. Dr. Delau, let's start this conversation from here. What are the common substance use disorders that you see in Zambia? What are the commonest that we see before we get into our subject for today?
Okay, so in Zambia, when we look at substance use disorders, the most common one is actually alcohol use disorders. So more basically any kind of beers or lagers or spirits, that are out there in our communities. And this is the leading cause of admission. And up to 49%, 49 to 50% of inpatient admissions, not just in mental health, but also in physical health, have to do with alcohol use disorders. So that's the very first one. But then we also have other substances such as heroin, which is an opioid, and this is also very common, specifically on the line of rail, such as Lusaka, Copperbelt, as well as in Livingston, as well as in Eastern. Then we also have other substances such as cocaine, and then which is a stimulant. Then, Dr. Mujajati, we also have tobacco use disorders. Now, tobacco is cigarette smoking, and a substance in it known as nicotine is arguably the most psychologically addictive substance because it acts as both a stimulant, which makes you feel excited, at the same time it calms you down. So a depressant as well. Then we also have our use of cannabis, marijuana, which is also very common in our practice, where individuals that end up overly using it come with substance use issues. And then, of course, we have things like inhalants. Now, these are substances such as paint thinners and glue that people start, concocting with, and they use that as well. But majority of the times, these are the most common substances. Then, Dr. Mujajati, we also have over-the-counter substance use, such as medications. And the one that is very notorious and very common in our country, and I'd like to mention this because it's an issue, and this has to do with codeine and cough syrups, which has codeine in it. People just go over the counter at any pharmacy, especially in these communities where there are pharmacies, and they just go and buy these substances, and they have codeine, which is an opioid, and they excessively use it, as well as other medications that can easily be gotten over the counter. So as you're aware, Dr. Mujajati, we have prescription medication. Prescription means that a doctor has to assess you and then write that medication for you, use that prescription written, go to the pharmacy and get that medication. But in our country, Zambia, we have people that just walk into a pharmacy, get that medication, and start abusing it. So these are the common substances.
It's interesting that you've talked about over-the-counter drugs. That has been a big problem. Codeine, benylin, and all that. It's unfortunate that it's becoming a big problem now. Now, doctor, a lot of Zambians do drink alcohol, particularly over the weekend. Quite a number of people do take alcohol. Now, having said that, when do you say, or when do you call it a problem? When does it become a mental health issue? At what point does alcohol use become a mental health issue? At what point does it become a disorder?
Okay, so a substance use disorder, and when I say substance here, I am referencing alcohol use disorder, is basically a mental disorder that affects a person's brain and behavior, as well as it leads to a person's inability to control their use of substances such as alcohol. So in this case, the alcohol affects the person's brain, and they have no control or little control or inability to control that use of alcohol. And then symptoms can range from moderate to severe. And addiction is what we call it when it's very severe, the most severe form of alcohol use. Now, in terms of alcohol, it becomes an issue when it's a recurrent use. So the pattern is such that you constantly keep using it, and it leads to clinically significant impairment. What do I mean by impairment? Now, with us as human beings and our brain, it allows us to feel, it allows us to think, and it allows us to perform in our day-to-day lives. When this is affected because of the use of alcohol, then we call it's a problem. Also, alcohol tends to not just affect the brain, but also leads to physical issues and physical symptoms. And when that happens, we call them alcohol-related health problems. And Dr. Mujajati, you have been an advocate for alcohol use and physical health. There is no organ in our body that is not affected by alcohol. So again, when that happens, when there are physical symptoms because of alcohol use, then it is a problem. Then we also talk about psychosocial disability. Our brain is responsible for functioning in terms of how we think and how we process our day-to-day life, how our memory is, and how we are able to perform our tasks. Now, when that happens, when there's a change in that, then that's called a psychosocial disability, and alcohol tends to lead to that as well. So again, when that happens, it is a problem. And also failure to meet major responsibilities in a person's reality around them. It may be just at home, it may be in their workspaces, both in the formal and informal sector, and also at school or home. So we usually call all of this a complex situation because a person ends up having an uncontrolled use of alcohol despite the harmful consequences that I've highlighted. People with alcohol use have an intense focus on using the alcohol, such as, even when they're at work, they're constantly thinking about, I want to go and drink. And as you've highlighted, yes, we have a lot of people in our country that say we just drink it over the weekends. But then, Dr. Mujajati, a lot of our people actually don't just drink over the weekends, but they constantly look forward to the weekends because they want to drink. Then that in itself is considered to be a concern and an alarm.
Mm-hmm.
Yeah.
Now, in Zambia, how big is the problem of the alcohol use disorder?
I would say, Dr. Mujajati, it's of great concern and alarm because when you look at our admissions, not just in mental health, in the mental health field, also in the physical health, the leading causes of admissions oftentimes have to do with alcohol. Let's talk of physical, then we'll come to the mental. When we talk about physical, in casualty and emergencies, road traffic accidents, and other emergencies often happen because of alcohol use as well. So we see a lot of that as well. Overdose and substance use with respect to alcohol is also seen a lot in the emergency when it comes to the physician side. And there's the condition, the medical emergency known as delirium tremens, which is because of um, a lot of alcohol intake. Basically, a person has taken so much alcohol and then they've suddenly ceased taking it, and then they go into acute withdrawal. And because of that, their body goes into overdrive, and then all of a sudden the brain shuts down. So this is what we call delirium tremens, and it's a medical emergency, and it is also very commonly seen in our practice. Then on the mental health side, we see a lot of people coming in with alcohol use disorders. It's the leading cause of admission, inpatient support in our mental health system here in the country. So when we talk about alcohol use disorder, substance misuse and abuse, when it comes to alcohol, it's very prevalent and of alarm.
Right. Now, doctor, tell us, how then do you arrive at a decision, or rather, how do you diagnose alcohol use disorder?
So, Dr. Mujajati, with alcohol use disorder, we usually have to understand why is it that the person has started. And also, we also look at, in the assessment, we also look at many risk factors or predisposing factors. What is it that will predispose, for instance, me to be an alcohol user that may end up becoming addicted to it? Oftentimes, when we're doing our assessment, we first start with history taking. History taking is where we sit down with the person, get the information, and we want to understand why is it that they've started using. And in this situation, we often find out that people start because they want to feel good. They start because they want to feel better, because they are stressed or they are overwhelmed. They want to do better. They want to improve their functioning because they've been told that alcohol helps with that. Or also, there's also just curiosity and peer pressure that people have. But other than that, we also look at the model that we talk about in mental health, which is known as the biology, the psychology, and the social model. So in the biology, we talk about genetics and inheritance. In our country, here in Zambia, alcohol is also inherited. Alcohol use pattern is actually inherited because of our lifestyle and our habits. So because of that, even before someone is born, they may have inherited certain genes that may predispose them to use alcohol. So that's where we talk about biology, and we look for that as well. Then there's a psychology, learned behaviors. We see a lot of people take alcohol in our communities everywhere. And if a child is growing up in that environment, that is a learned behavior, subconsciously or consciously, that they're learning. And if that child grows up in at 10 or 11 or 12 and starts experimenting and using alcohol, then again, that is the thing that we are looking for. Then finally, the socioeconomic status and education background. So when we're doing an assessment, we are looking for all of these things. And we're looking for unhealthy alcohol use, which is often looking at the many symptoms that we want to look for. And these symptoms that we look for include being unable to limit the amount of alcohol a person drinks, wanting to cut down the use of alcohol, but they just can't. It's just unsuccessful. Every time they say, okay, this week I'm going to reduce my drinking, it's just very difficult. They spend a lot of time drinking or getting alcohol or recovering from alcohol use. So these are probing questions or symptoms that we actually look out for. A feeling of strong cravings. Cravings is basically your body is constantly thinking, wanting the need for you to take alcohol, or your mind is constantly telling you psychologically that you need to drink alcohol to feel better or calm yourself down. Then there's also failure to fulfill obligations at work, at school, or even in their homes, because they are constantly using alcohol or drinking alcohol. They also have issues in their personal lives, interpersonal relationship concerns that come about. So, Dr. Mujajati, there are many, many questions that we probe. Or we actually look at a person fully, trying to see how is it that this person's alcohol use pattern is, and how is it affecting the individual. Now, Dr. Mujajati, when we talk about diagnosis, people need to understand that it's not just, oh, the person is taking alcohol, so it's an alcohol use disorder. There are many different ways that alcohol affects the brain. There's what we also call alcohol amnestic use disorders. Amnesia basically means memory. And alcohol in our country has, depending on how a person's use pattern is, if a person is taking a lot of alcohol in a short period of time, the brain becomes overwhelmed and the body also becomes overwhelmed. So basic micronutrients also become, reduced, and these individuals start having memory lapses and they start having confusion. So this is what we call alcohol amnestic disorders, which is also very common. You see a young gentleman, a young lady coming in their early 20s, 30s, and then they have memory lapses. So we also diagnose this in psychiatry and mental health. And there are specific types of alcohol amnestic disorders. Some of them are reversible, others are not. So there's also that which we diagnose. So we go into specific details in diagnosing what is it that comes. And then Dr. Mujajati, with alcohol use, over time, even in a short period of time, depending on the amount that the person is taking or the type of alcohol the person is taking, they also end up with what we call adult malnutrition. A person may just look physically okay, but internally, their nutrient levels have gone down and they end up having malnutrition. And they end up having, concerns such as the physical concerns, which I won't go into detail because that is not part of mental health, but they end up having ulcers and other micronutrient deficiencies, which leads to a lot of mental health challenges. So in a nutshell, Dr. Majati, it's a whole process. We literally have to not just, do the assessment of the person, the examination that we do physically assess the person, but we also do a lot of blood investigations and also may do some brain investigations so that we know exactly what we are dealing with to diagnose an alcohol use disorder.
Excellent. Now, doctor, like we mentioned, a lot of Zambians do drink, and a lot of them do drink excessively, actually. So now my concern here is it that everyone who drinks excessively has an alcohol use disorder problem or alcohol use disorder issue?
So the answer here is no, Dr. Mujajati. And the reason here is because we all have different genetics. Even if we are all born and bred here in Zambia, we still have different genetics and DNA. A person who may be drinking alcohol may have a family history where they are not drinking at all. There was no family person in their family who was drinking. So that person may not have genetical influence. But then that person may have an environmental influence. So you look at many factors. Also, about 70 to 80% of people who drink excessively would not meet the clinical diagnostic criteria for having a severe alcohol use disorder. Again, this has to do with their body type and what type of alcohol they are taking. Let's talk about spirits, the two jili that are found in our communities. It depends how much a person is taking, for how long, for the duration that they've been taking, and what are their patterns of alcohol use. Are they just drinking alcohol and going from alcohol use to alcohol use, or are they having meals in between? Are they hydrating? So all of these things come into play. A severe alcohol use disorder was previously known as alcohol dependence or alcoholism in a long-term state, in a chronic situation. And the signs and symptoms of severe alcohol use, Dr. Mujajati, are inability to limit the drinking. So many people are able to, limit their drinking if they want to. So if they are unable to limit their drinking, then we actually say, okay, this is a problem. Or also they are able to continue to drink despite personal or professional problems. Okay, so if a person has professional or personal problems such as interpersonal violence, social withdrawal, relationship problems because of their alcohol, then that's a problem. But many people are able to see that, okay, this is causing me a lot of problems, so I can actually do something about it and maybe reduce my drinking. Then also needing to drink more to get the same effect. This is what we call tolerance. Okay, so if a person continuously maintains the same amount of alcohol they've been drinking, say they started drinking as early as 18 or 19 or 20, they were drinking 1 or 2 beers every other day, and they've maintained that up to their 20s, 30s, and 40s, then that's okay. As opposed to a person who started, 1 or 2 bottles every other day, and then now today they've reached a situation where every other day they're taking 7 or more bottles. Then that's tolerance being built up, and that is a problem. And then finally, individuals that have so many cravings, wanting a drink so badly that they can't think of anything else. many people have actual control over their alcohol use as well. So it depends. Not everyone. The answer to that is not everyone that we come across has meet the criteria of an excessive drinker.
Right. Now, Doc, related to the same, what's your take on the increase in minors who are abusing alcohol? Children. A lot of children are abusing alcohol. I mean, children, I mean, kids who are below 18, it's becoming a big concern. What's your take on that?
Dr. Mujajati, so my specific interest is in youth mental health, and I say this because majority of our people are the youth. And the best example, even when I'm teaching at UTH to students, I usually tell them and give them an example of highly densely populated communities such as Chawama or Kanyama. When you go through such townships, and I'm going to be as blunt and as honest as possible. When you go through these townships, and I know because I practice there, every other shop is a bar or a tavern that sells alcohol. And after hours, when you pass through, say, Kuku Market or Kuku Road in Kanyama, after hours, every shop starts selling alcohol. Now, here's a young person who's born in that community. They're going to school or they're going to work every day in that community, and they're seeing adults do that around them. Okay? Houses in those communities are brewing alcohol. Okay? So they're actually growing up in an environment where this is normal, this is okay, this is the day-to-day reality. Now, that brain is actually being structured, the neuronal plasticity, the way the brain is being functioned, the connections, actually seeing that this is okay, this is normal. So when that child grows up at the age of insight, where they're able to understand things, maybe 10, 11, 12, they're going to start, curiosity will take the better of them, and they will start using the substance, which is alcohol. And if they start doing that, first, they may already have a genetic link from the family link. Secondly, they already have an environmental hit now. And third, there's also the socioeconomic pressures that come in. Then they may start using it. So from me, as a mental health specialist, it's not uncommon to see a young person in our country, both in an urban setup like this or a rural setup, taking alcohol. And this is something that we all need to understand as a country as well. We need to be understanding to say this is a normal reality. But we do need to understand that it is not okay. We need to start having this conversation. And this question that you've asked me is very cardinal, because children that start drinking alcohol before the age of 15 are 5 times more likely to develop an alcohol use disorder and dependence, such that by the time they're in their mid 20s, they may start experiencing memory concentration challenges. And this just shows that it's an issue. It's a big issue, because these individuals will not be as productive as they are supposed to be in terms of their psychosocial well-being, and they may end up becoming a burden to their communities and to their surroundings. So it's not okay, but it is something that is happening in our communities, and we need to understand that.
Now, Doc, I need you to address the people who are watching us now. There could be some who are very active drinkers of alcohol. How would they know that they now have an alcohol or a drinking problem?
Okay, so knowing when you have an alcohol use problem is basically also knowing when to come and see me as a psychiatrist. Uh, and this is where you need to understand, individuals need to first understand all the things that we've discussed so far, to say, look into yourself. Are you someone who has a family history? When I say family history, is there anyone in your family from your mother's side or your father's side or your close relatives, your uncles or aunts, who have been using alcohol excessively? Ask yourself that question. If that is something that you've grown up around, then that is something that you should be concerned about. Also, the second thing is, how long have you been drinking? Is that something that you just recently started and it's causing alarm in your life? Or is it something that you've had over time? So drinking too much on a regular basis for an extended period or binge drinking, binge meaning you're taking more than the amount required for your daily activities. you know. If have you started at an early age? When I say early age, before the age of 20 to 18, did you start drinking alcohol prior to that? These are questions that you need to think within yourself. And then there's also, do you have underlying concerns with respect to self-esteem, your mood? Are you someone who is very irritable and anxious or angry all the time, and when you take alcohol you feel calm and you feel happy about yourself, or you feel much more collected and you are able to function better? Then again, that is something that you need to be aware of. Then also you need to understand, do you have any history of trauma, such as emotional or other trauma, such as abuse in any way growing up as a child? This is also something you need to be aware, because that can also increase your risk of end up having a substance or alcohol use issue. Then finally, your cultural surroundings. What environment did you grow up in? Have you grown up in an environment where everyone around you has been drinking and there's a lot of peer pressure? So these are the first things that you need to ask yourself, as someone who is wondering to say, do I have a drinking problem? If you've answered yes to any of these, then you go on to the second part of the questioning. And this is where you ask yourself, am I able to go about every day and be productive? When I say productive, are you able to be functional? Are you able to wake up in the morning, or even go to bed at time at night and have a good night's rest, and wake up in the morning and be able to go about your activities, such as your work, your schooling if you're in school, or just do something that makes you go in your activities? Number two, are you having challenges in your personal relationships? What I mean by personal relationships, with your siblings, your brothers and sisters, or your parents, or anyone around you, or your work colleagues. Okay, how are your relationships around you? Are there challenges in your relationships? If they are, then again you may have a problem. Then number three, you also need to ask yourself to say, are there times during the day where you constantly feel the urge or the need to take alcohol? You just feel like, okay, I need to drink to just calm myself down, or I just need to drink to take the edge off, to feel normal or feel calm. All right, then again, that is a problem. The fourth one is, have people around you, the people that care for you or that you are surrounded by, mentioned to you to say, hey, I think you have a problem. And have they raised that concern? And have they done it over 3 times? And is it 3 different people have mentioned? So if you answer these questions, if you say yes to these questions, then there's a high likelihood that you have an alcohol use problem, and you need to see a mental health professional or even a healthcare worker who can guide you further, so that we can actually go through the diagnostic criteria and actually tell you where you lie. Are you a moderate, do you have a moderate substance use, alcohol use issue? Do you have a mild alcohol use disorder, or do you have a severe alcohol use disorder?
Right. Doctor, the other issue I need you to address here is that why is it that some people would get addicted to alcohol while others don't?
That's a very great question, Dr. Mujajati, and I get this question all the time. Many people in practice will tell me to say, no, but my uncle drinks so much, and he's just fine. He's professional, he works, he's okay, there's no problem. And also in the informal sector, where I'll have people tell me, but doc, all my friends, they drink excessively, but they're able to function. But I just drink a little bit, and I can't go about my activities. So it's a hard one, Dr. Mujajati. As far as science is concerned, there's no right answer to this, but we do know that genes, genetics, and familial link and inheritance plays a role, because there is an inclination for addiction which runs in families, such as any other non-communicable disease like diabetes or hypertension, which runs in families. We also know now that alcohol use disorders with respect to severe alcohol use addiction actually runs in families. And also, we know that the person's environment also plays a part in addiction. For example, what are the factors that encourages someone who has tried alcohol on taking it at a point where they can't stop? And this is where, again, the example I gave earlier on about environments comes into play. So we are still trying to give you the perfect answer to say you know what, you are at a high risk of, getting an addiction problem, as opposed to you won't get it. But the answer here is, it has to do with your genetics, your familial pattern, as well as your environment. This is why some people end up becoming addicted, and other people are not, usually addicted to alcohol, and they have seasons where they take alcohol and then they just quit completely, and then they end up, living a healthy life.
Hangover, doctor.
Mhm.
Tell us about this hangover issue.
Yeah,
Um,
and mhm.
how does hangover come about? What is that about?
Okay, so hangover is basically a definition or a term that is used when a person takes excessive amount of alcohol according to their body type or nature or DNA or genetics, and the following, after 8 to 12 hours after alcohol use, they feel physically overwhelmed, and their body is unable to, just cope with the alcohol use that they've taken. So this is the time frame in which the body is trying to metabolize all that alcohol, or use up all that alcohol that the person has taken up. And when that is happening, the body manifests certain physical symptoms as well as psychological symptoms. So there are several reasons why people experience hangovers from drinking. One component is dehydration, and this is very, very important. And coming back to you, Dr. Mujajati, um, people may think taking alcohol and, just drinking water is just any other thing, but it's very, very important, because water actually helps the metabolic process of alcohol use as well. So when a person is severely dehydrated and they take a lot of alcohol, then they have a higher risk of developing a hangover. Alcohol causes the body to get rid of too much fluid. When the alcohol is being broken down in our body, it takes up a lot of fluid, and it metabolizes and uses up a lot of fluid. And the dehydration that results can cause headaches, which is a symptom of a hangover, nausea, which is basically feeling like you can't, eat anything and you just want to vomit, thirst, you feel like you just want to constantly take a lot of water, and other symptoms of hangovers, such as, physical pain, or just feeling, photophobia, which basically means you can't take any light. Or some people also have sensory issues, such as not being able to take any sounds as well. So while some people think that alcohol helps a person sleep, it actually disrupts sleep as well, and hangovers actually lead to that as well. And this can lead to, grogginess, reduced attention, reduced concentration, and it also accompanies hangovers. So in a nutshell, this is what a hangover is, Dr. Mujajati. It's due to unhealthy alcohol use take, and it's because the body is trying to use up all that alcohol that you've taken over a short period of time. And as the body is trying to use it up, metabolize it, it goes into dehydration, and when it goes into dehydration, it leads to all those symptoms. Yes.
Now, in discussing issues of addiction, what is it in alcohol and other substances that makes them addictive?
Okay, so different substances have a different effect on the brain, but our brain has what we call the reward pathway. Reward basically meaning, to be given something in return to make you feel motivated or happy. And we have different receptors and neurotransmitters in our brain responsible for these pathways. Now, as I said, different substances react differently and in different ways, but they all cause release of a neurotransmitter, a basic structure in our brain known as dopamine. And dopamine is known as, the high or the happy hormone in the brain's reward area. And this is what actually causes the pleasure and the pleasurable sensation, the high that comes with alcohol use. So once a person starts using a drug repeatedly, and in particular alcohol, you keep using it, their brain starts to adjust to these surges of dopamine. Every time you use alcohol, dopamine is being released, and with each time you're using it, the dopamine receptors, they get used to it. They get basically, they get so used to it that the next time you take the same amount of alcohol, it won't produce or release the same amount of dopamine. So for you to uh, feel that high or that way again, you need to take more alcohol. So this is what happens with the reward pathway. It's like the simple example I can give you is sugar use and tea. When we put sugar in our tea, say for instance, you're always taking 2 sugars or 3 teaspoons of sugars in your tea. But today you've decided to take something sweet, like, sweet potato or a biscuit that you've eaten before having your tea. You will notice that your tea won't seem to be as sweet because your taste buds have already had something sweet. So you'll add more sugar to make it used to. So this is what the brain starts doing. With the more amount of alcohol that you use, the less amount of pleasure or high that is being produced. So what will happen is your brain will tell you to say, take more, take more, take more, so that you can feel that high, the same high that you felt immediately before. So this is what happens. The brain cells start changing themselves and make fewer dopamine receptors, and they simply produce less dopamine. And this results in a lower amount of, high. And it's like turning down another example I can give, Dr. Mujajati, is the radio, or when you're listening to something, turning down the volume on the reward signal. So every time the person wants to feel that same high, they have to start increasing the volume. And that basically means taking more and more amount of alcohol. So this is how substances actually work in our brain. And our brain is very unique in the sense that it knows the right amount of high to produce. So when you start giving it substances that work on it from outside, like alcohol, then the brain will say, okay, so this person is already giving me something from outside. So I'll just start, not working as hard as I'm usually supposed to. And now let's just use what this person is giving us. So they'll keep, signaling you to keep using more and more and more so that you are satisfied. So at the end of it all, Dr. Mujajati, it leads to what we call a brain disease. So this is what people need to understand. Over a period of time, alcohol use disorders turns into a brain disease. It is not just an attitude problem or an attitude concern that many people think of to say, it's just a problem or she's just a problem. No, it actually, the brain, the structure of the brain starts changing. So that is what makes these drugs, and in particular also alcohol, to become, make a person become addicted.
Now, doctor, let's spend the next few minutes talking about treatment. How then do you help somebody who clearly has an alcohol use disorder?
Okay, so with respect to helping someone with an alcohol use disorder, it's a journey, and this is what I'll start by saying, that it's not a one way ticket or a simple thing. It takes time, and I often tell people to say, if you ask yourself all the questions that I've asked earlier on, to say, do you have a family history? Is there someone in your family who has a similar concern? What environment did you grow up in? At what age did you start using alcohol? What is it that leads you to use? What is your motivator? Why did you start using it? When you look at all of these questions, you come to realize that it has been a period of time um, until which a person became used, or rather severe substance user and addicted to alcohol. And again, the brain has become used. The brain structural functioning has also changed. So because of that, it's a journey. It's not a one-off thing where you come to me, I'll assess you, I'll diagnose you, I'll support you with a program, and then you will just become fine. No. People need to understand that it is a journey. That's the first thing. The second thing, in terms of treatment, Dr. Mujajati, there is what we call the understanding. Is it that the person has just an alcohol use problem? Or is it that the person also has underlying concerns? Do they also have other mental health disorders, such as bipolar, where they have highs and lows and they're using alcohol to self-medicate their problems away? Do they have underlying psychosocial stressors in their life where they're using alcohol as a means to cope with their stress? Do these individuals have an anxiety concern where they're actually using alcohol as a means to medicate themselves? So we also look at all these things. So when we find these comorbid or supporting diagnosis, then we actually treat those diagnoses and then support the alcohol use. Then as we're assessing the person, we also look at the physical issues. Does the person also have physical symptoms? And as I guided to say, does the person also have memory lapses, nutritional imbalances? So we also support them with medication that will help them with aligning or bringing back their nutritional status to normalcy, so that we can improve or reverse all the symptoms that they are facing. So usually when a person comes in with alcohol use disorder, we actually look at whether this person is experiencing alcohol withdrawals, or whether this person is actually having alcohol dependence, or whether this person is actually having an alcohol addiction. So we need to understand these things because it really helps. If a person is actually having withdrawals, then we immediately support this person with the withdrawal symptoms. So withdrawal symptoms can be things like seeing things that are not there, hallucinating, hearing things that are not there. So we give them certain medications so that we can quickly control those symptoms. Is a person severely dehydrated? If so, we quickly support them with fluids, certain fluids that help bring back the nutrients into control. Then one thing is with alcohol use, apart from leading to dehydration, it also leads to low sugar in the body. So we also control that in terms of treatment. And then after that, we take them through a 7 to 10-day period of detoxification. What do we mean by detox? We want to dry out the body with alcohol. Basically, we want to make sure that the body uses up all the alcohol that the person has taken. And also the brain starts, the receptors are starting to become open that have been utilized because of the alcohol. So in the detox program, we give medication that mimics or works similar to alcohol, but it is not as risky as alcohol. So the medication we give works similar to alcohol, but doesn't have the same health consequences as alcohol has, risky health consequences. So we do that from anywhere from 5 to 7 to 10 days, and we reassess. And sometimes we may even go up to 3 weeks. After that, we start with what we call motivational interviewing and therapy, where we're trying to understand, to say, what is the underlying cause why you are using alcohol like this? And we want to understand whether you are ready to stop, whether you are ready to quit, or how motivated are you? Because we want to make sure that we are supporting you and you are not being peer pressured around you to do something that you are not yet ready. So we start this kind of therapy sessions. And with time, Dr. Mujajati, as I said, this is a journey. It takes anywhere from 1 month to 3 months to 6 months to a year. One thing people need to understand, Dr. Mujajati, with alcohol use is that there is and there will be relapses. What do I mean by that? A person can go through this treatment plan that I've shared with you. I can start them on this treatment plan for 1 month, they are fine, and then 2-3 months down the line, again, they've started using. This doesn't mean that the person is a problem. No, it simply means that the person is still going through treatment. It's just like diabetes and hypertension. You can start on medication, but they can still have relapses and they can still have complications. Remember, with alcohol use addiction, the brain's pathways have changed and it takes time. So we need to be supportive. And a key treatment, Dr. Mujajati, is the environment. Environment is very important because a simple example I will give you, Dr. Mujajati, is if you're passing through a place where they are making bread and that bread is smelling very nice, even if you don't want to buy that bread, you will crave of that bread. Another example is Hungry Lion. You pass through any Hungry Lion outlet, you will smell it and you will be craving for Hungry Lion, even if you've said you don't want it or you didn't think about it. Similarly, environment matters. If a person is in the same environment where they can easily get access or see things that are easily accessible in terms of alcohol, then that is going to lead to a relapse. So these are key things. This is why in developed countries, in ideal setups, there are what we call rehab centers or rehabilitation centers where we take people away from the environment for a few weeks to a few months so that they can go through this process. And then once they are out, they are able to focus and function. But when they come back to that same environment, and if there's no good social support in their family, in their friend circle, there is a high chance that they are going to relapse. And if they relapse, again, I will echo this, that is not a problem. It simply means they are still going through the journey of treatment and it is a process. Yes.
Doctor, you see, we are about to go into the festive season. It's about to be Christmas, and and people will drink. Now, can you address yourself to the do's and don'ts of alcohol use? Here, I need you to comment on the healthy way of drinking alcohol.
This is a very good point, and again, this comes back to advocacy and awareness. We know that we keep saying that alcohol is a common social thing that we use in our practice. I'm sorry, in our environment, in our surroundings, and if you as you've highlighted, alcohol use is actually a common thing in and during holiday periods and Christmas as well, and New Year's as well. So people need to understand that there are healthy ways of drinking alcohol. Again, we are not promoting alcohol use because there is no healthy level of alcohol use according to science today. So please don't take this as saying, oh no, Dr. Mujajati and Dr. Dalal said that this is how you drink alcohol healthily. No. But we are saying that if you are taking alcohol, then you need to make sure that you are using it in a certain way such that it is not going to lead to these consequences that we've actually mentioned. So now, what are some of the healthy ways? The first thing is to understand how much alcohol to take. And again, there is no right amount of alcohol. But for a male, you need to understand that when we talk about things like Casa Lager or beers, that the normal bottle level is, you need for a male you need to take no more than 4 to 5 in a day. Okay, and for women it's half that size. Again, when you have someone like this, me, who is actually small built, it doesn't mean that 4 is for me. No, for me it means I also need to understand my body type and also my physique. So I need to understand that. So that's number one. Number two is understanding that before you go drinking, make sure you've had something healthy. Make sure your stomach has enough carbohydrates. Carbohydrates have enough energy and sugar in it because alcohol breaks down and uses up all the sugar in your body. So you need to make sure you've had a meal before you are taking alcohol. So please understand that as you're taking alcohol, any type of alcohol, make sure you've eaten something. Number three, as you're taking alcohol, in between your alcohol, make sure you drink water because alcohol use intake takes up a lot of water in your body, and you're also going to lose a lot of water because of the breakdown of alcohol. So you need to make sure between alcohol use, between your drinks or between your bottles, you're actually drinking water. It's very, very important. So these are certain healthy ways that you need to understand that you're drinking alcohol during this festive period. Number four, we talked about alcohol use in the underage and minors. Please be understanding to say, look, yes, you may not be drinking excessively in front of your children, but they're still seeing it. And there's also other factors around them in the environment. On social media, also around in the communities, they are seeing alcohol use. So please try to limit your drinking in front of your children. And don't ask your children to bring you a bottle or do certain things. Do it yourself. Be a responsible adult around children. That's the fourth thing. The fifth thing that I will say is activities and things such as driving and also um, um, using machinery or going to work under the influence of alcohol. Please make sure that you have a designated person around you that is going to support you as you're drinking, because we see a lot of road traffic accidents as well as industrial occupational um, casualties in this period, and also in the homes. Number four, if you have an alcohol use problem, then please reach out for help and don't partake in a lot of alcohol use, because there's a lot of gender-based violence and interpersonal violence within homes because of alcohol use. So these are certain things that are do's and don'ts when it comes to alcohol and healthy alcohol use.
Right. Doctor, we are still dealing with the advent of COVID. What are the issues relating to alcohol use disorder and COVID? What are the concerns in that regard? And here I'm asking relating to some of the myths that you have come across.
Okay, so initially, Dr. Mujahati, it's very alarming because of the awareness and understanding. did you know that during the second and third wave in particular, at the outskirts of Angola, we had people in communities there taking spirits that we use in our practice to swab patients in our practice. And that spirit is not for consumption. Alcohol, because we started having these preventive measures to say you should wash your hands with soap and water or use alcohol-based hand sanitizer. So when you use such terms, people started thinking to say the alcohol that people use to drink is the same alcohol that you can actually use to clean your hands. So people started misusing alcohol that is even used in the health industry and started drinking it. That is a myth. Please understand that alcohol that is used to to used to drink, in terms of that we can consume, we can take as human beings, is totally different than the alcohol that is actually used in hygiene and sanitation. So please, that's a major myth that I would like to break in our country. And we're also seeing that in our communities here, where people are not understanding that spirits that are used in the hospital are not meant to be drunk. So that's a myth that I would like to break. Then there's also consuming alcohol, just the general alcohol like tujili or beers and lagers, destroys the virus that causes COVID-19, the SARS-CoV-2. So it's not true. Consuming alcohol will not, and I repeat, will not destroy the virus. And its consumption is likely to increase the health risks if a person becomes infected with the COVID virus. So please understand that it doesn't disinfect your internal body if you take alcohol. It doesn't work like that. Immediately the alcohol reaches the mouth and starts going to the stomach, it starts becoming metabolized, it starts being broken down. So please understand that it doesn't work like that. Then the other one is drinking strong alcohol kills the virus in the air that you've inhaled around you. And it does not do that. The alcohol that you drink will not kill the virus even around you. So this is also something that people are not understanding with respect to alcohol use and the COVID-19 virus. They feel that alcohol is going to help them, prevent them from getting COVID-19, but that's not true. On the alternative, it's actually that alcohol has a very bad effect on your immune system. It leads to micronutrient deficiencies and will not stimulate immunity, and the virus will actually even get a higher ability to make you more ill. So these are certain myths, Dr. Mujajati, that are very common in our environment with respect to COVID-19.
Dr. Delau, I'd like to thank you so much. I know we could have gone on and on and on. Like you rightly pointed out, this is our first in the series of substance abuse disorders, and we decided to start with alcohol because it's very common. So let me thank you most sincerely for coming. What's your final word to our listeners and our viewers?
This is what I'll say. We need to understand, to all the people that are using alcohol and feel that they have an alcohol use problem, and also the people that are living with people that may have an alcohol use problem. This is a collective approach, because support means that people that are living with alcohol use need people around them that are going to be supportive. Please know that if you are someone who has an alcohol use disorder, you are not a problem. Please understand that. That this is a disorder of the brain that can be treated and that can be reversed, and it's a journey. And to the people that are overwhelmed and living with people who are abusing or misusing and addicted to alcohol, I know it's very overwhelming. I know it's a lot of work to support an individual, but please understand that it takes time for treatment to be effective. So that's my take-home message for everyone, to say it's a journey, and we do have professional mental health care providers in our country, and please reach out to a healthcare worker so that you can be supported.
Right. Dr. Dalal, thank you very much, and enjoy the rest of the evening.
Thank you.
Take care. Right, ladies and gentlemen, there you have it. Thank you so much for joining us today, and do us this one big favor as usual. Just go, before you leave, please click that share button, share this video as much as possible. We need this information out there as much as we can. So as usual, please, before you go, click that button and click share. We need as many people as possible to have this. Having said that, until next time with another exciting topic with Dr. Delau, probably next Thursday, do take care and enjoy the rest of the evening. Take care.